I'm AFT President Randy Weingarten, and I want to welcome you to another episode of Union Talk. For this episode, our fourth one, we are taking you inside America's hospitals. Not to talk to the people who run these hospitals, not to talk to people that you would normally see on TV, but to talk to three nurses and AFT members who have been on the front lines caring for patients during the last 18 months that we have experienced COVID-19.
It's important to be part of a union because you have to have a voice.
For nearly 18 months, frankly, longer, day in and day out, nurses and health professionals have been battling wave after wave of this pandemic, trying to keep us safe and alive. And in the first few months, they were battling something that was completely unknown. And in the second few months, battling something that was still completely unknown. And yet they were the front line. And as all of these months have endured, they are still the front line. In the early days of COVID, when I, here in New York, which is where I'm taping this, could hear every literally 10, 20, 30 seconds, constant sound of ambulance sirens. Nurses and other healthcare professionals were in hospitals, doing mandatory overtime, completely overwhelmed, terrified, and lacking the basic safety provisions like PPE and other things to keep themselves and their families safe. For weeks and even months, they lacked respirators and other safety gear that they needed. Often, N95 masks were being reused. Respirators, ventilators were being reused, other equipment, to the point that people were nearly in positions of not knowing what to do and how to keep each other and patients safe. And frankly, instead of getting these heroes and heroines, Shiros, and all the others who worked in healthcare what they needed, we had a lot of problems, shall we say, with the last administration. Trump even accused nurses and doctors of stealing PPE rather than actually creating and directing through the Defense Production Act every measure in the United States to get these frontline heroes and sheroes what they needed. Our union, which represents more than 200,000 nurses and health professionals, fought tirelessly to get nurses the PPE they needed, even going so far as buying hundreds of thousands of masks ourselves. And with a new administration committed to providing nurses and health facilities and other healthcare professionals what they need, and with the vaccines that have been available since January, we initially felt that there was a pathway and a path to relief. But then, with each and every one of these variants, we see one more time us relying on these amazing frontline providers. The Delta variant, combined with vaccine hesitancy, has led to a surge, a pandemic of the unvaccinated that once again has overwhelmed hospitals and ICUs and continues in countless communities up until today. We're starting to see some relief again, but ultimately this has taken its toll. In a recent poll of AFT healthcare members, we found that less than 1 in 3 were satisfied with the conditions facing healthcare workers, that almost 60% said that conditions had worsened over the past 5 years. Low staffing, stress, burnout, and turnover were top problems. These were problems beforehand in healthcare, and now they have been exacerbated by a pandemic, the first pandemic we have had in over 100 years. So the nurses we're talking to today, they're the front lines. We want to spend a little bit of time trying to not only shower these amazing frontline nurses with the gratitude that we have, but we want them to share with you what they're facing every day and what they need to stay or to be safe and healthy. It's a powerful conversation that I have been looking forward to, and I'm so grateful to be joined by Joel Hernandez, a nurse at St. Charles Hospital in Oregon and a board member of the Oregon Nurses Association, Tisa Williams, a nurse at the University of Cincinnati Medical Center and a member of the Ohio Nurses Association, and Jessica Harris, a nurse at Bacchus Hospital in Connecticut and a vice president of the Bacchus Federation of Nurses. So I just want to say, Jessica, Tisa, and Joel, thank you so much for being with us, and thank you for sharing a little bit about what you've seen and been up against for the last 18 to 20 months. So I'm going to ask each of you kind of like a general question, which is, you've been on the front lines. What's it been like for you personally and for the other nurses and health professionals in your hospitals? Just give us a little bit of let us see a little bit into what you've experienced. So let me start with Joel, and then I'll go to Tisa and Jessica, and then I'll switch up the order.
Thank you, Randy, for having us. I'm here today with you in this podcast. So what I've experienced in the past 18 months, almost going on 2 years now, with COVID, it has been just an emotional roller coaster. I work at a hospital. My wife also is a physician, is a hospitalist at the hospital that we work at. And when this all started, we actually had the conversations about what would we do if one of us ended up dying or ended up in the ICU, and who would take care of our kids. And I think that set the tone for my family and I from the beginning of this, right? Just uncertainty and being just kind of scared of what's going to happen, just on the unknown. As we progressed, our hospital, at the beginning did very well. Like they moved out of the way. Administration moved out of the way and said, you know what, you're the clinicians, you're the bedside nurses, you're the bedside physicians, set up policies. What do you need? How can we help? And it was beautiful. It was amazing when you had the MDs and RNs start tackling this issue, and you had the CEOs and the MBAs move out of the way. It was pretty amazing. We got these policies in place that were, we made in a week about how to treat these COVID patients, where to place them, and what to do, essentially. PPE at the beginning was very difficult, and this is one of the biggest battles we had. First is we couldn't get PPE, correct? And so what we had is members of the community, nurses and physicians, reach out to industrial companies here and give us respirators to help us use. And there was big arguments with the hospital, like, well, you can't use these; they're not medically. There's no medical use for these. And physicians, anesthesiologists, all were, no, we're doing this. You can't give us PPE to protect our staff. We're going to do this and start protecting ourselves. So it was pretty amazing. As things progress, it was pretty amazing how everything got politicized and how everything seemed to feel like it was us against. It was very politicized. It was right between left. And I saw this here in Bend, particularly more than anywhere, I think, for me, was Bend, Oregon itself is pretty affluent. It's a kind of a vacation area. You want to come here, there's multi-million-dollar homes, and it's pretty expensive to live here and very difficult to live here if you don't have a wealth. As you go outside of Bend, it is very rural cattle, there's farming, and you can see that great divide here of what's going on in the city and in rural. And right now, we are going through a tremendous surge of COVID. We're doubling up our ICU beds right now. We have 2 ICU patients with COVID in each room because we're just at capacity. We're doing emergency surgeries only. So what's happening now is like we're doing surgeries, but these patients are coming in are so sick, and it's just so taxing on our healthcare system because they're taking up so much more resources because they're waiting to come in because we can't do the surgeries that they need desperately. So that's been hard. We're tremendously understaffed. So we have, national, FEMA has brought in nurses to our hospital to help us with staffing. The other day, we're at a floor which typically has about 28 nurses on that floor. About 26 of them were all travelers. So it was, the resources there was tremendous, and it becomes pretty taxing on the staff there normally, because they are expected to help these travelers know what they're doing and oversee everything, and it's become taxing to them. Overall,
It's almost impossible.
Yeah, it's almost impossible, and if anything, it's an emotional roller coaster. If anything, it's just, I'll give one of the main examples, and I'll leave it at this, is I was in the ICU the other day, and we were talking about, we just had 9 COVID deaths in the last 12 hours in our ICU. And like, we're just talking about, like, it was like no big thing, We had to get a truck to bring in and put these bodies in because our morgue is at capacity. And then so I leave and I go to one of our grocery stores. Nobody is masked. No, I know like a lot of these people are not vaccinated because of the rural areas, but there's this disconnect. The people are not seeing what we're seeing. People are coming in air hungry and still dying. And there's still like, there's no connection with the community. They're like, oh, this is a big hoax, or, oh, it's not going to affect me, until it does. And so that's kind of disheartening thing. And the having fatigue in the matter of your compassion is gone. Sometimes you feel like you're banging your head against the wall, trying to tell these people to please get vaccinated. And the truth is about close to 95% of our people in the ICU are unvaccinated. There are some that have breakthrough cases, and usually the ones that end up in the ICU are the ones that have some severe immunocompromised, other comorbidity. That's good to put them in there. But for the majority, is people that could get vaccinated that just decided not to because of misinformation or how it's been politicized.
Well, Joel, and part of the reason we wanted to do this particular podcast is that we want people to hear real people who are on the front lines, not this kind of false, oh, how great to have these heroes, but this kind of sense of the complete fatigue that you've gone through as a healthcare worker who's tried to help save lives, and how impossible it is for anybody to work with 26 travelers in a unit. I mean, it's impossible. So thank you for sharing. And let me go to Tisa and then to Jessica.
Most of the patients that we were getting, the problem is that the acuity of the patients, they demanded that critical care piece. So the problem is that as far as like the beds that were equipped for the ICU, that critical care piece, we did not have enough of those beds. The beds that we did have was just the inpatient, regular med-surg floor beds that we had, which we didn't have the beds that were equipped to take care of the patients that, that were in the area that we had. And, the area that we have, is a lot different, than what Joel was talking about, where our hospital is a part of like an inner city. A lot of people, they need a lot of help. We need more providers for them. We need more opportunities for healthcare. We could use more clinics. People, they don't have the resources, that a lot of other people have, that are outside of the community of Cincinnati. So we do see a lot of people that, otherwise, they come to the ED, and it's not necessarily an emergency, but because they don't have a PCP, they don't have the insurance to see a PCP. You'll usually see them. So our EDs is always overflowing, in that inner city area. So, so at that time when the pandemic had first started, at that time I was a regular floor nurse. Right now I'm a float, but I worked on a transplant floor. So at that time, we weren't allowed to necessarily have COVID patients on that floor. So I didn't see a lot of COVID patients because of the immunosuppression. So, but I know a lot of my friends were floats and they worked the COVID floors nonstop. They said it was definitely exhausting. They said that, the people were very, very sick. They said that, just coughing, just, they were exhausted. They said they were very sick. A lot of them, their O2 stats, they just needed their O2 requirements were through the roof. They would come in and they would say, they had no baseline O2 requirements at home. And then they would be on 10 liters of oxygen and they were scared because they were like, I don't know what to do. I'm not a respiratory therapist. There's no ICU beds. What if something happens and I have to call a code? What if I have to do a rapid, and then there's, or they're calling rapids and there's no place to put these people in an ICU bed. So they would go through these things all night long and, and just be scared because they're like, I'm not trained, as an ICU nurse. I'm not trained as that, so I know those are things that they had went through at the time. So now come fast forward, through the pandemic now, which in my mind, I guess I thought we would be through. I guess in my mind,
Yeah.
I didn't think that this would
You thought it
still
would be
be
done.
lasting. I really
Yeah.
did. So fast forward now, now that we're doing surgeries, mask mandates are up, we have a vaccine, floors are open. But we are still, we're still at capacity, at our ICUs. I know that as a float, we do helping hands. We'll go to the ICUs, and I know that they'll be split. Half of the ICU will be dedicated to COVID patients. The other half will be dedicated to non-COVID patients. But the thing with the Delta variant that I'm seeing is a lot of non-vaccinated people are getting it. And the acuity of the patients, even from before, is just not, my O2 requirement, is high. But we're seeing a lot of people that are definitely, they're coming in with comorbidities. A lot of them have COPD, they have asthma, diabetes, obesity, and then on top of that, not vaccinated. A lot of pregnant women that we are seeing, that they're having fun, they're on vacations, they're coming back, and now you're seeing them on a ventilator from getting the Delta variant from COVID. And, even on the, yes.
Not vaccinated, right?
Yes, not vaccinated, and on the floors, right now we're taking care of COVID patients, and it's not that we're getting a lot, but from what I'm seeing is that they're sicker. Now they're very sick. It's just like they're there for maybe 1 or 2 days. And then it's just, they're sick. It's not just a cough. It's not just an O2 requirement. It's high fevers, and the fevers are just not going away. It's the myalgias, the aches are not going away. It's, it is the, pneumonia. The people are getting pneumonias afterwards. And then that's basically taking them to the ICUs. And then the pneumonia is taking these people out. People are dying from, COVID pneumonia is what they're calling it. A lot of people are getting that as well. And we're also seeing younger people, and it's not just people in their 50s and 40s. We're seeing people in their 20s, with COVID. So, we're seeing a lot of that too. And it's just sad. And, when you go in and you conversate with these people and, they'll tell you I was so against being vaccinated. And now I'm trying to call my mom and I'm trying to call my dad and I'm calling my grandparents and I'm telling them they don't want to be this sick. And, I'm trying to tell them, get the vaccine. And, I'm trying to let them know, I didn't think that I could be this sick. Or they'll tell you they let their guard down. They were, out at big family functions and they didn't have a mask and they didn't think they needed it. And, or no hand hygiene. They just wasn't washing their hands or, just different things like that. And, and now they're sick.
Thank you, Tisa, for sharing. It's just, again, just like I said to Joel, it's important for people to hear people who have been feeling so much and see what happens when people are so sick and work to try to help. um, this whole, and I'm going to get to Jessica in a second, but this whole pneumonia, the lungs collapsing, not being able to breathe, which is terrifying to the person, but it's also terrifying to a nurse who is trying to figure out how to help somebody. And so you can hear that in your voice. Jessica.
Well, similar to Joel and Tisa's, you know, experiences, is that initially we closed down all outpatient surgeries, and they did a lot of like reorganizing of the staffing at the hospital to try to make room and make people be more prepared for having these sicker patients that we were expecting. And our numbers last year were in a year and a half ago were much, much higher than they are today. And a lot of that I think is because our area is pretty highly vaccinated, but we are still seeing a lot of the unvaccinated people coming in. And just like Tisa and Joel, they're just really, really sick. They're young. They're otherwise healthy. One of the hard things going through this was trying to keep up with the ever changing policies and procedures, and how are we supposed to handle these patients, and it would change literally hourly, and we wouldn't necessarily have the most updated information on how they wanted us to be handling these situations. And I work in the emergency department, so it's been crazy there. It's been crazy trying to figure out how to triage people, how to put them in places where they're, not going to be exposing themselves to other patients that might not be sick, are there for some other reason. It's been really rough. And as our overall census has gotten higher just from regular patients that come to the hospital, seeing even just a smaller number of COVID patients has put a strain on our healthcare system in Connecticut, because they still take up a lot of resources, and other people are having to be put in hallways and not be put in rooms, because there's just no place to put them, because the COVID patients that are there take up so much resources, need private rooms, things like that. And I have seen it be really tough on the staff. And I remember in the beginning wondering if I was going to have to try to separate myself from my kids, if they were going to have to go stay with relatives, because we didn't know what we were getting into, and if we were going to bring it home to our families. So it's been very stressful and very taxing. And there has been a lot of turnover in the emergency department and throughout the hospital. People just aren't wanting to be at the bedside because it's just really tough.
All of you kind of hit on this a bit, but I'm going to start kind of with Tisa in terms of, okay, the vaccine question, the mask question. Like, what was all of our personal journeys on this, and how do we convince people to get vaccinated? And, or do we? Should we be trying to? Is this something that we as a union, is something that you individually take on? So let's start with Tisa.
When it comes to the simplicity of things like hand hygiene, mask wearing, I know that as far as healthcare professionals, we always talk about evidence-based practice. That's our favorite thing to always talk about, especially in nursing. We spend years, taking care of patients who have the flu. I mean, we wear masks, when we were taking care of patients, as far as like who had the flu, and we go in there, we wear a mask, we wear a PPE. And, even, before I became a nurse, I was an STNA, and, I would take care of patients, and, that mask, helped me to not get the flu. It protected me from respiratory droplets. I didn't get the flu. I would take care of geriatric patients. They would, not purposely, but they would cough on you, sneeze on you. A lot of times you'd be transferring them over into a chair. You would get some things on you. That's the reality of it as nursing. You get a little slobber, and it's just kind of like, oh gosh, you'd be thinking, oh man, I'm going to be sick, but you'd have your mask on, and you know what? It'd be a month later and you're like, oh, I'm fine. I didn't get the flu. So that evidence right there just shows you how, okay, as my experience at the bedside, mask work. I know people, now a lot of people, especially not in healthcare, especially, have made it so political. They're like, masks don't work. That what is a mask? That's not going to, as far as what I know from evidence-based practice that I have practiced, masks do work. I took care, of COVID patients for months, that were hacking, coughing. I was wearing my N95. I was wearing my mask, and I was fine. I'm a single mom. I have a son, and I had lots of concerns. And because I thought to myself, like, it was a scary thing and we didn't know anything about it. I thought, like, do I need to be making a will? Do I need to stay away from my son? Who's going to watch my son, as a single mom? How's he going to get to school? If I have to go away and stay in a hotel, what do I need to do to keep my family safe, and things like that.
That would have
But
been
then,
so stressful.
yeah. And then when we think about the vaccine, I was hardcore. I'm not getting that vaccine for a very long time. And I do want to touch upon this just a little bit because I know that religion is a big reason why a lot of people are not getting the vaccine for religious reasons. For me, I am a Christian. I know a lot of people feel like they read Facebook, they get on social media, they go to church. A lot of people will say things like, don't get the vaccine, it's the mark of the beast, or don't get the vaccine, you're not going to go to heaven, you're going to go to hell. These are things that are out there that are being told to people. People are getting scared because, if you're living a certain way and your spirituality, your religion is very important to you, then you don't want to do things to compromise that. So when you hear those things, something like a vaccine, can compromise, you going to heaven, something that you want to do, then you're not going to take it. Or when you're constantly going to church and you're feeling like you're being attacked, or, you're feeling like, they're telling you you're being a part of the crowd, or, or whatever may have you that you're hearing, and you're thinking to yourself, oh, okay, well, I'm not going to get that. Or you're hearing, oh, I'm hearing about all these people are dying, that are getting the vaccine, or, it's bad for you. And, and I thought to myself, okay, so I just had made it a point, I'm also in grad school to be a nurse practitioner. I want to go into infectious disease, and I was doing my clinicals with an infectious disease doctor. And I remember he sat me down and he said, Tisa, he said, what do you really know about the COVID vaccine? He said, have you even educated yourself at all? What do you even know about it? And I felt so stupid. And I said, I don't know anything about it. I literally have not sat down. I have not gone on the CDC. I have not sat down, educated myself about it whatsoever. The only thing I could tell him is what I heard at church, what I saw on a social media website. That's all I could tell him. And then he said, as a educated nurse, as somebody who is going to school to go into infectious disease, he said, it's your responsibility to educate yourself. And he said, if you're going to make a decision to get or not to get a vaccine, you should at least educate yourself on why or why not, that you're going to get it. And I thought that was such good, crucial information for me. So I had went and I thought, I'm going to educate myself. I'm going to see, what is it? What is it about? What are the side effects? What are some possible things that couldn't happen? And then I also thought to myself, I'm vaccinated with all these other things. I didn't have no problem getting polio shots, getting, Hep B, Hep A, I get my flu all the time. I never question that. I just stick my arm out. We go to the doctor, we get on meds. People, we're in such a high health, as far as mental health, we have no problem going to get psych meds. We get on anti-anxieties. We don't question it. We just go home and then we wish the doctor had given us a higher milligram of it, to help us go to sleep at night. We don't question it, And then, and there's all kinds of side effects that we can have from that. But, we're questioning this and then we want to go and we're taking care of other people's loved ones. So, to me, as personal, for me, I prayed about that. I've spent thousands of dollars on an education doing something that I know that I'm called to do. And I don't want to ruin my career and my education and to not get a vaccine. So, I felt that it was right for me to get it. So, my thing is this, I know people don't want to be forced to do things, and that's the freedoms that we're allotted here in America. But, if you're not going to get a vaccine, at least educate yourself on why you're not going to get it. Don't just not get it because you heard something on Facebook or because a family member keeps talking negative about it and you're like, oh, I'm not going to get it because TT over there said, no, don't get it. Everyone's dying from it. At least educate yourself, see, what it's about, see, how it affects people, educate, educate, educate. That's just the one thing, that the token that I can put out there, and especially if you work in healthcare, we've got to, take care of other people too. It's not just about us, because I know if my parents are immunocompromised, and they're in a hospital, I want people to do all that they can do to protect my family just as well as, I'm going to do for somebody else.
Thank you, Tisa. I'm going to ask Joel, and I really appreciate you sharing your story. And look, there's a lot of skepticism, and I'm not all that sure that we did as good a job as we should have as the United States of America in getting that information out. It all got, as Joel said earlier, it all got done through a lens of politics as opposed to, what, that this was the single most important way of making sure you didn't get really, really sick. Remember, people thought, oh, well, that means I'm never going to get COVID again, or I'm never going to get a breakthrough. But it was really, this is the single most important way to make sure that you're not, getting really, really, really sick or dying. And, more and more information is coming out now. And I think we have to learn how to do a better job, even in this polarization, about how to make sure we get real accurate information out that can't get distorted. Um, Joel, you're spending a lot of time doing outreach to immigrant, to Latino communities in Central Oregon. What's your message to them when you start talking about vaccine outreach?
I think the biggest thing is just educating them. Well, the message is, my biggest message is, please get vaccinated, period. I mean, in what I found mostly in the Latino communities out here, especially even throughout California, because I have quite a bit of family in California and a lot of family in Mexico, is that they're not educated. There's no really outreach out there to tell them this is what's going on, this is where you do it. There's always this sense of, I don't trust it. I don't know about it. And it's once you have that conversation with them and tell them, hey, this is the benefits. This is what you need it. It's going to keep you out of the hospital. It's going to protect your family. They're very, very open and saying, yeah, okay, absolutely. But again, it's like the misinformation they're getting of like, oh, it's the mark of the devil, or you're going to hell, or, there's tracker devices in it, or it makes cows sterile. It is this weird, like, all-encompassing misinformation that even it gets to all communities. For me, like in the Latino community, it's just as a matter of just sitting down and having a conversation. And there's usually one or two questions like, well, I don't know anything about it. No one's told me anything about it. And it's like, as simple as like, explain to them, this is how it works. This is where you need to get it. It's going to protect your family. And being in the Latino community of, immigrants, we live in community settings where there's a lot of people in one house, right? And you can't isolate, right? You can't isolate in your own house when you have people living, 6 or 5, 10, 12 people living in one house. You just can't. So you have to protect yourself best you can. And these individuals cannot stop going to work because they do not eat, right? So they don't have a choice. They have to go do your laundry. They have to go work at the cash register at the grocery stores, right? So they can't protect themselves. Even if they get a little sick, they still have to go to work. So I tell my Latino community is like, hey, you just need to get this vaccine. It's going to help you, yourself, your family, and protect yourself. And it comes down to me, what I end up seeing is more of a individualism versus collectivism, right? You start thinking yourself more like you are part of this community. What are you doing to protect this community? What are you doing to protect your neighbor? And what I found, at least in my culture, it's very easy to convince somebody about that. Like, hey, what are you doing for your tia, your uncle, your neighbor down the street? you know she has diabetes, she has hypertension, you know she's going to get sick, what's going to happen, right? It's like, yeah, I know. Okay, so what is the big holdup? And it's a simple question like, oh, I don't know anything about it. And just educating them is the biggest thing.
Thank you. And Jessica, I'm going to actually turn to you on something that just riffing off of what Joel said about community, because you're in a state that has a pretty high vaccination rate. You're in a community that has a pretty high vaccination rate. But you've created in Bacchus, there's been a lot of struggles, been a strike, there's been a lot of stuff. Just like, in Bend in St. Charles, there was a strike this year too. But there's been a lot of um, work that you've done to create a Bacchus community of nurses and health professionals. Have you found that that has talk a little bit about this kind of individualism versus community and whether or not, coming together as a community in the during the strike and the aftermath of the strike has been helpful, or there's been some residual negative effects or residual positive effects? Talk a little bit about the community aspects here.
I think that the work that we did before and during and after the strike really helped to bond the nurses at Bacchus together. And, we did have a big sense of community. And what we were doing was for the community. We were going on strike. It was a very tough decision for a lot of people to make, to feel like they were leaving their patients. But ultimately, we were doing it for the betterment of our patients, of our hospital, of our community, to protect our families and make our hospital better. Um, and I think, with COVID, we were really we just were very a cohesive group of, nurses, and we hadn't always been like that at Bacchus. Um, there's been a little bit of a rift, I think, between the nurses with the vaccine mandates. Initially, when the vaccines weren't mandated, they were just offered. Everyone who wanted one was just lining up to get them. I got mine as soon as I could. Most of my close, coworker friends also did. And then when it came down to something that was going to be mandated, we've seen a little rift in our cohesive group, because there was just people that just didn't want to be told that they had to get it. So that's been something that's been hard for us to overcome, because, we want to, of course, support people's rights to make choices about their healthcare. We advocate for that all the time. But also, like Joel and Tisa have said, is that you have to have a bigger sense of community and doing what's right for the greater good. And it's been a little bit of a challenge, I would say. I think that we're at high 90s percentage wise as far as nurses being vaccinated. But it took the mandate, and it took the threat of them, having to either resign or be terminated for that sort of last little bit of nurses to decide, okay, I'm just going to go ahead and get this. So, it's been a challenge. Whenever anyone's told they have to do something, whether it's get a vaccine or wear a seatbelt or, whatever the new law is to protect the greater good, I feel like there's always a group of people that, some of them have valid, legitimate medical reasons that they can't get the vaccine, and that's understandable. But some people, they just don't have, much of a reason at all, and then they just don't want to. So, we try to support our members and make sure that they have a right to make choices about their healthcare, while also being advocates for the greater good, and, making sure that we're all trying to do the right thing. And that, I think as a union, our position is that the vaccine is safe and effective and the best thing that we can do to get through this pandemic. So that's our position, while at the same time trying to, be just aware that people have opinions about this. And, we still want them to be a member of our Bacchus community, of our nurses union community, while hopefully they, come to a conclusion that's best for themselves.
I see, she's, shaking her head. I mean, and I was gonna get to the question of this kind of union voice and what's happening, but she said that I saw you shaking your head, so I wanted just to see what, if you had some kind of comments or riff off of what Jessica just said.
There just seems to be a little division going on right now, between nurses. Right now, when there's a pandemic, it seems like we should be coming together. There should be more of a cohesiveness between us, because we're all experiencing the same thing. So, this should be a time where we have each other's backs. It should be a time where we're helping one another. And the union right now, and I seen firsthand just the other day when I went to my first labor meeting with administration, I saw firsthand, I have a newfound respect for our union. Definitely. I saw what they deal with as far as, bargaining, as far as, representing us, as far as, like the back and forth of what they deal with and trying to negotiate and trying to get, things that we need and making sure that our voices are heard. But I am seeing the divide, and it did kind of start with the vaccine mandates. People don't like to be told what to do, and and I do believe in the power of choice, and it is hard, because there are some people that can't, for medical purposes, can't get the vaccine, and and it was very hard to see that there were actually a lot of good workers, especially people that were phlebotomists, that were pregnant women, that were up in the air about getting the vaccine, that were, weren't sure, should I take this, with the baby and that kind of stuff. And we had already talked about seeing, rates in pregnant women getting COVID and stuff, but, that they were mandating them as well, to get the vaccine, that were like, well, I'm quitting because, I'm not going to get the vaccine. I don't know how it's going to affect my baby, or, this, that, or the other, and we're already experiencing a lot of nursing shortages, especially, with patient care techs, which is such a pivotal piece to the puzzle that we need. We need that help, right now in the hospitals. And I know that that's definitely caused a rift, in our nursing community. And, and also, as far as like things that they have tried to come up with as far as trying to compensate, for the nursing shortage, for the staffing, they've tried to come up with bonuses for nurses or, trying to give us more pay, or trying to, help out, as far as like, the relief and the more work and, the staffing shortages, it's actually caused more division because I know administrations a lot of times, and even now, yeah, they've come up with bonuses. They might have given you more pay or, given you COVID relief crisis pay and stuff, but they've also decided, okay, well, these nurses, they deserve pay, but we've left out these nurses. They don't deserve the COVID pay. So now you're working alongside nurses that are making 3 times as much as you, and they're not taking care of COVID patients, and you're taking care of COVID patients, and you're not making even half as what they're making. So not only are you going through like, okay, I'm being mandated to take a vaccine I don't want to take, is what a lot of people are thinking. But now there's this huge wage gap. I'm working hard, taking care of, these patients without the help, that, we need. And I'm not making the money that my coworker over here is making. And they've got some, chill assignment, is what we kind of call it, on the floor, they've got to put your feet up at night assignment, and I'm running around with 5 COVID patients, So, I shook my head because when she said that, I'm definitely seeing there's just so many caveats right now to, this pandemic and really just, there's so much division. And unfortunately, I hate to say this, but a lot of it is coming from administration. And it's so important to have this union right now because if we didn't have a union, I don't even know how our voices would even be heard because for some reason, they've been nurses on the floor. A lot of this administration, they started off as floor nurses. So I don't understand why they act like they don't know what we're talking about when we come to the table to talk to them, because, they didn't get in those executive positions just overnight. They didn't come from home. They were ADNs, they were RNs, they, have their MSNs, they came from somewhere. So, I mean, it's really, disturbing to me that it's hard to communicate with them like, hey, there's, some things going on. Like, how can we level out this playing field? How can we make this right so that we can come together and take care of our patients?
You just made the case. And I mean, as you were talking, Chisa, I was remembering, Joel, you know, part of the fight. Now, the nurses had a union, but the fight in St. Charles, for the OTs and the PTs and the other techs about the complete misalignment of pay. And that was part of the strike in St. Charles. And it is part of, many times it is part of the equity strikes that we have, or the negotiations that we have to try to create some fairness in pay scales, which Tisa just, talked about so beautifully. But, that's part of the voice that without a union, look, this is called union talk, and that's what we're trying to do in terms of the podcast, like thinking about the relevance of unionism. But part of this is both creating equity, but also think how open we all are right now about the dissent and how we're trying to get through real friction between people who were very much like, we need the vaccinations because this is part of how we keep everybody safe. And then we have some people within all of our units who are saying, no, that's, this is my right, and this is my right, and I should have the choice. And we as a union, you locally, think about the kind of grace and patience and, a real sense of bringing people together, not demonizing people, trying to make sure that that what we're about is greater than our divisions. And that's what gives me hope about America, that it's workers working with each other in a very tense and tough moment where we're trying to bring everybody together. I just really, I can't thank all of you enough for that work and that kind of bringing people together in that kind of way and not demonizing them. I do want to, before we end, get to what if you could tell management, right now, what they should be doing, or you could tell Joe Biden right now what he should be doing to kind of end the nursing shortage, to alleviate the stress and strain that you have all experienced in the last 18 to 20 months. Say he was listening. Say your management was listening. Say they were a captive audience. What would you tell them? Like, what do they need to hear about how we deal with this? So, Jessica, I'm going to start with you in terms of mandatory overtime. What would you tell them about mandatory overtime and what we need to do about it?
Well, I think we need to do away with it. It's counterproductive. We've lost lots of nurses because they don't know if they're going to get to go home when they come to work in the morning. And, nurses are being mandated on some units, 2 or 3 times a week for 8-hour additional shifts. And that's not sustainable. And I know at the end of my day, fortunately, for whatever reason, the ER doesn't have a lot of mandates. We do have some, but we're a large unit. So when you get rotated through mandation, it's only happened to me once. But that day, I just remember it was such a horrible day, and I couldn't wait to go home and to be told, you can't go home. You have to stay here because there's no one to relieve you. It was devastating. And I just, I don't know how the nurses on the inpatient units that see the mandation so much more frequently, they deal with it, because I couldn't imagine going to work, every day wondering if I'm going to be allowed to leave or not. And, we have made many proposals to management about how they could avoid mandations, and they're not receptive to them. You know, as it is with our current contract, if you get mandated, you get paid double time. So we have suggested for the last couple of years, even, to, if you get to the point where there's a last minute call out, something has happened, census has surged, and you're at the point where you have to mandate, instead of mandating, put out a text, to all the nurses saying, hey, we need someone to come in right now for double time. Because then you get a fresh new nurse who wants to come in. You're still paying the same double time. And it's just things like that they don't ever want to hear. They just tell us that would never work. That's a terrible idea. We're not going to do that. So instead, we're going to essentially abuse the nurses that are already there by forcing them to stay, which then makes them want to quit. And they do. So, there has to be some other way to get people to, want to come in and work the shifts versus forcing them, because it's completely unsustainable. And having a constant turnover of healthcare providers at the bedside is not good for the patients. It's not good for your coworkers. It's just this constant cycle of training people, getting them off orientation just to have them leave. And when units are staffed with mostly, newer nurses, that's not a great plan. You got to have a mix of senior nurses, newer nurses, in order to have a safe staffing situation. So, yeah, if I could tell management and then they were listening and they were going to listen, I would tell them it has to stop. But it can't stop in a way where then all the nurses who are working just get 2 or 3 extra patients, because that's also not sustainable. You got to find a way to get people to come in of their own free will.
Have to alleviate the nursing shortage.
Yeah. And, we already pay travel nurses so much more money than you pay nurses that actually work there, that have been there, that have stayed there. And that just has always boggled my mind, that you would pay a nurse who's coming in saying, I'm a temporary person. I don't have loyalty to this company and I'm going to leave in 8 weeks. You're going to pay them 2, 3, 4 times, who knows how much more, than you'll pay someone that's worked there for a long time, or that wants to work there for a long time.
So part of what I'm hearing you say is, and then I'm going to go to Joel and then I'm going to go to Tisa, but part of what I'm hearing you say is we got to actually make sure that the pay scales for folks who work in healthcare kind of befit and are high enough so that we're going to actually get people to change their mind and become nurses in this period of time.
Right.
And stay as nurses in this period of time. And if you can do it for a traveling
Right.
nurse, then we should be able to do it for, the nurse who actually commits to the community forever and ever.
Yes.
Got it. So, I'm going to tell podcasters who are listening, this is going to be part of what we talk to management about all across the country. I mean, any nurse who's listening or other healthcare practitioner knows this, but we got to figure out how to make sure that these kind of funding scenarios are part of Medicare and Medicaid and part of what is being funded for healthcare, and that when a hospital gets a whole bunch of money from the federal government, like in CARES 1 or CARES 2 or American Rescue Plan, it doesn't line somebody's pockets. It actually goes to the purposes intended. And that's part of what I'm hearing Jessica say as well. So Joel, what would relieve, you were so emotive when we started this podcast today about, what you saw and what you see. What's the solution? What could help relieve that stress? What could help relieve the shortage that you see?
I think the main one for me is putting your employees before profit. And it's as easy as that. Invest in your employees, invest in their future, invest in their happiness. And that will be paid back to your company 2, 3, 4 times fold. But this is the issue that I'm seeing, the same as Jessica in Connecticut, is we have 80 to 120 plus travelers right now. Okay. They have no loyalties here. And I've actually heard it from patients that have been on floors where a majority of travelers are taking care of them, to they have to get transferred out to a different department where it's mostly employees that have been there for a long time. They're like, wow, I could tell a difference. I'm like, why? What do you mean? So it seems like you guys care a lot more down here. I'm like, well, why is that? I'm like, I don't know. It seems like you just care a lot more down here. And I take that to like the people that are coming to work as almost like, I could say, like as travelers, they don't have any loyalties here. Zero, right? And the employees that live here, work here, are taking care of their neighbors, are taking care of your daughter, are taking care of your son. They care for you on a different level that these travelers just don't. But that's the sad thing, is they're paying these individuals so much money to come in and do these jobs that some of our staff are now looking and saying like, look, and excuse my language, is like, if I'm going to be treated like shit, I'd rather get paid well and go somewhere else and travel.
Yeah.
And that's the bottom line is going on, is that these administrations, these hospitals, these corporations need to start investing in their employees. Be Bhutan,
Patience.
which for me, Bhutan is you measure happiness.
Right.
You take that into account of your employees and make that a value. They make something that you strive for, to have your employees be happy, be content. They want to be your employee.
Wouldn't it be amazing if some of the quality assurance that gets done with the regulators included that as a standard? That would change things. If we could
Absolutely.
get, we're trying to figure out what is it that we can do as a union to actually make sure to make this real. And, as you were talking, Joel, I'm like, maybe we could get a well-being index as part of quality assurance.
Yeah.
Then they'd have to measure it. Then they'd
Yeah.
have to actually listen, as opposed to it simply being the union at a meeting like Tisa was talking about, actually, saying to management, start actually looking after your own self-interest in terms of treating the people who are treating the patients, well. Treat the people who treat the patients well, not just the people who are on high. And Tisa, you get the last word here.
Mhm. I mean, they pretty much said it. I mean, I don't know what else to say. I'm just like, pay me, pay me, please. I mean, this, we get treated. We don't get treated like people think we do. I mean, as nurses, it's kind of like they ring a bell, a little bit. It's kind of like, it's a rough job. It's kind of like.
Yes.
You go to school and they kind of make it seem a certain way that it's textbook. It's not. It's a hard job. You're on your feet. You overlook a lot of things. You overlook a lot of, disrespect. You overlook a lot of things, and you just truck along, and you take care of people the best that you can, even though you might feel a certain way. You might be treated a certain way. You just go through it, and you're just like, you know what? I'm going to do the best that I can do. I mean, it's you work hard, you work short, you're a jack of all trades, you're EVS, you're the PCA, you're the phlebotomist. I mean, you're the nurse, and sometimes you're the doctor, and you're a counselor. You do a lot of things. And it's like, it's time for administration to step up and and recognize it. And I don't understand the pushback. I will say, they have made some strides, in offering, some different things in wages and some languages, as far as crisis pay, COVID relief, things like that. But, don't leave some nurses out and make it seem like some nurses deserve something and some don't. Just make it available to all frontline staff. We're all working hard. If you're working in the front lines, you deserve that pay. And especially, you should, if if you are a union nurse, you should be getting that money, and you should not be giving it to non-union members and not giving it to your union nurses. That is wrong. So, that's another issue, but pay us, treat us, with respect, and treat us like, that we are needed, and that you appreciate us. I love it when they say, we appreciate all that you do. Okay, thank you. Then pay me, please.
Show me.
So,
Show me
yes.
the appreciation.
Yes, please. We work hard. We come, we are loyal to you. We take care, of your place. We take care of the patients. We have relationships there. We have ties with these places. Please, show us, that we are appreciated. We are appreciated.
So I can't, thank Joel and Tisa and Jessica enough for this powerful conversation. But what it's done for our podcasters is that you're seeing real people talk about real issues that have affected them, nurses in healthcare, over the last 18 to 20 months, talking about what has happened from their perspective, from the bedside, in all sorts of different places in the United States, Connecticut, Oregon, Ohio. We need to listen to these nurses. We need to respect them. We need to pay them and show them the kind of dignity that they deserve. Not just have, every other billboard that says, thank you, nurses, but actually treat them as the heroes and the sheroes that they've been. People who have saved us, who have cared for us, who have sat at our bedside. People who have made sure that safety and health is indeed not just in word. So, backs up, mask up for now, and let's actually honor the nurses who have worked during COVID to make sure that everybody else is okay. And I thank all the listeners for joining us for this latest episode of Union Talk. I hope you're enjoying the podcast as much as I'm enjoying doing it. I hope you can subscribe so you never miss an episode of Union Talk. And until next time, I'm Randy Weingarten. Thanks again for listening.